Undertakers dressed for medical battle. Their white protective suits a striking contrast to this red earth. Another soul laid to rest in the Villa Formosa cemetery in Sao Paulo. It's a disturbing ritual repeated up to 60 times a day, proof that COVID-19 is now rampant in Brazil's largest city. Families have little time to say goodbye. They tend hastily dug graves, uncertain who or where it will strike next. Nurse Nathalie Cuiaba lost her brother aged just 43. He had classic symptoms of the virus.
A enfermeira também não falou que se ele tossisse, alguma coisa, ela não ia entrar porque eles estavam com muito medo de ser o vírus. E aí meu irmão faleceu em casa.
She blames Brazil's president for the disaster.
Ele ainda fez uma brincadeira, né, que é uma tossinha, mas você vê aqui o tanto de campa por essa suposta tossinha.
When Sao Paulo tried to shut down, President Bolsonaro publicly condemned the move as harmful to the economy. But hundreds of new graves are now needed to take the mounting COVID casualties in a city of 20 million. Everywhere you look in this cemetery, there's row upon row of freshly dug graves. Confirmation that Brazil now has the highest daily death rate of any country in the world, and perhaps even more frightening, one of the lowest testing rates, and no planned way of how they're going to get out of this pandemic. Brazil's hospitals are overflowing with people who are fighting for their lives. Doctors at a Sao Paulo field hospital work as fast as possible to intubate a 43-year-old man whose oxygen levels are critical. Do you think this man will survive?
Sim, tem chance.
Yes, he has a chance now we've stabilised him, the doctor explains. Staff are working 12-hour shifts. They're all volunteers. In one of the most dangerous environments, they receive infected patients close to death. The 10 intensive care beds at this field hospital are already full. Patients unconscious and kept alive by machines. There are enough ventilators to treat the sickest patients, but they're running out of the drugs needed to sedate them while they fit the breathing apparatus. There's just 3 weeks left, then they don't think they'll be able to get any more. Staff fear that they will soon be overwhelmed.
Sim, os casos estão aumentando a todo momento, né? Cada dia os casos estão se tornando uma realidade assustadora, né? E a gente preocupa, né? E o medo, o nosso medo é que aconteça colapso.
The Brazilians call this a Corona Combat Hospital, built in 6 days on the site of a car park to take the overflow from the city's public hospitals, which are all full.
Curadas, em nome de Jesus, meu Deus.
No one is allowed to visit in case they too become infected. So friends of one of the patients hold a prayer vigil outside, obviously distressed. Next to the hospital is a testing site. They've run out of reliable swab tests, replaced with temperature checks and a device to measure oxygen. Lack of testing capacity is a chronic problem for Brazil. The health minister resigned because of the shortages. Doctors are desperate for the government to do more. They're calling for a nationwide lockdown.
I think if we don't do the lockdown, the cases will be more and more every day.
In Rio de Janeiro, the governor has locked down. Against the president's wishes, he's closed the beaches and told tourists to stay away. But it hasn't spared the city from the ravages of corona. The anger over the damage the virus is causing has divided Brazil. Supporters of President Jair Bolsonaro, who is against any quarantine measures, stage a rally beside Copacabana Beach. I agree with him totally, one supporter tells me. Thousands have lost their jobs. We can't listen to the people who tell us we should stay at home. But streets also reverberate to more traditional protest. Pots, pans and insults aimed from balconies at Bolsonaro's failure to tackle COVID-19. Nurse Cidinha Duarte was just 63 years old when she died from the virus. Her family accused the government of murdering her, alleging she was forced to work without protective equipment.
A minha mãe foi assassinada porque eles não tiveram compaixão da situação dela. Então eu levo sim isso como assassinato.
Their mother also infected her son. Alexandra is 39 years old, now struggling to recover after 32 days on life support.
Que isso não é uma brincadeira, isso é sério. Porque é só você passando por esse problema para saber o quanto grave é. As pessoas hoje pensam que o Covid-19 é só uma fantasia, mas não é.
The virus knows no boundaries, but the favelas are least able to protect themselves. These densely packed shanty towns are home to 13 million people in Brazil. More than 100,000 of them live in the ironically named Paradise City. They have no ambulances, so community leaders have raised money to buy them. Just how much harder does COVID-19 make it for everybody living here?
As pessoas já tinham medo, né? Esse medo cresceu porque o vírus já chegou na comunidade.
Volunteers also cook free meals to encourage residents to stay at home rather than going in search of work. Keep a metre apart, they shout, as the food is distributed. Essential help in a country where welfare support is limited or non-existent, around £100 a month if you're eligible. Yes, absolutely. The hospitals are packed and I don't want to die, these men tell me. In Rio de Janeiro, the favelas cling to the steep hillsides, but fear of the pandemic is just the same, exacerbated by endemic poverty. In Vidigal, the streets are sprayed with ammonia in the hope of getting rid of it. In the distance, we can see that the beaches are empty, but here in the favela, it's impossible to stay 2 metres apart. We've been told that just 5 people have lost their lives, but the evidence from talking to people here is that it must be far higher. Most people on these teeming streets seem to know someone who's lost their life. Elizabeth's elderly neighbour died after emergency teams ignored calls for help.
Aí chamando a SAMU, demorou mais de 3 dias para eles poderem vir. Davam a área de risco.
There are tentative steps to reopen Rio and its famous landmarks, as the president urges Brazilians to return to normal life, despite the fact that this country has just recorded its highest number of deaths in a single day. Worse still, the peak of this pandemic may not have passed yet. The World Health Organization warning deaths in Brazil are likely to keep rising until the end of the month, a painful prospect for this embattled nation.